Good afternoon, everyone. This is Mayor Pete Bass, and I wanted to update you on the coronavirus. That's an epidemic, a pandemic for us nationally. First, I'd like to start off with the fact that we do have our first positive test for coronavirus. Our public health director, Mike Crespin, had notified me of this. This individual is a female between the ages of 45 and 60, and she is right now self-quarantined. She was tested positive. She also has a husband who's self-quarantined and a son that's home from college that's also self-quarantined. They're all self-quarantined. When we get more information, I'll also go ahead and publish that as well on our social sites. Also want to talk about on March 17th, and how we do our policies and procedures as a town government moving forward. As well, I just want to let you know the last 2 days I've met with all of our town departments, reassured our town employees of our policies and procedures, and some of them you may know about already. Some of them are, for instance, when you go into our town buildings, it's right now by appointment only. You have to call, make an appointment. Then the person will come to the door and greet the people that are coming in to get service from our town employees. If we can do, and the less people that we have coming in our municipal buildings, for right now, the better. We have continual cleaning from our facilities department, and I'd like to thank our facilities department for doing a yeoman's job to continue to clean and make sure that our town buildings are sanitary and making sure that we're attacking any kind of germs or bugs that are there. We're also following our hand procedures, washing hands, soap, water, as much and as most times as we can. And I also recommend that to you, the public, as well. As the doctors say, that's one of the #1 ways to be preventative is hand hygiene, which is washing 20 seconds under the water. And if you have a nail brush, using a nail brush as well to get under your fingernails, all in an effort to combat this virus. Also, things that we're doing is we continue to work with our task force. And in our task force, some of the things we're doing is both short-term planning as well as our long-term planning. We've been meeting now for almost a month and looking to refine and continue our processes and procedures. As this continues to unfold, we continue to update our policies and update our procedures and how we do things. One of them is, for instance, our food bank. We've partnered with our CERT team and our youth agency so that we're doing these things outside, and we're making sure that there's the least amount of touches for both the resident that's needing assistance and our departments, making sure that we try and keep as much hands off as we possibly can. I'd like to thank Ivana for really coming up with this new protocol, and there'll be more to follow on that as well. Some of the other things that we're working on as well is looking at different opportunities that we can do to help our residents as well. Our senior center is, though it's closed to the public, when you try to get into the senior center, we're doing work inside and also getting meals to our seniors, delivering them, also having our bus take seniors to their appointment to continue not only servicing our seniors, but doing it in the best way we can to protect them and to protect our town employees. I met also today. I was at both roll calls for our New Milford Police Department, and I want to thank all of our first responders for being really the boots on the ground as we're attacking this pandemic. I wanted to thank them for their service and also let them know about the continued policies and procedures that we're doing as a town. The more that we can be communicative, not only to you, the public, but to the town government, to work together to move forward with this. I was on a conference call today with the governor and our economic development commissioner, and we were talking about access to funding And moving forward, I'll be pushing those out on the social sites that are going to help our small businesses and those that unfortunately have been laid off. I'll be putting more of those on my social sites, the governor and the to our businesses and to our residents. There'll be more to follow on that as well. Also, I've activated our Emergency Operations Command Center. And basically what that does is it gives us the availability to track some of the expenses that we're going to be incurring, so that hopefully when the federal government, since this has been declared a national emergency, we're going to see if we can get some funding back for that. Jim Furlow, our EOC commander, Kevin Reynolds, his assistant, and also our public health director, and many others are going to be in our central command. I'll be following up with you on that as well as we move forward on our EOC command. So I'd like to thank those gentlemen. I'd also like to thank all of our employees. They're doing a wonderful job in these uncertain times, and I can't thank them enough. As I told them all as I went to all of our departments, is without them, government will cease to work. How we're going to be handling our town government when it comes to boards and commissions. I'll be talking about that a little bit more tomorrow, first on our social sites, as we're getting prepared to make sure that we're being compliant with the regulations that were sent out by the governor. So we want to make sure that when we do hold meetings, that it is accessible to you via technology, so that everyone can still do the main thing, which is to correspond, to give us your input to the commissions and whatnot. But we also want to be safe. We want to be safe for our volunteers. We want to be safe for our town employees, but we still want to conduct town business. So I'd like to thank everybody so far that's been involved in doing that. These things continue to change on an hourly basis, and we'll continue to update you as things are moving forward. One of the things that the governor did say today on the conference call is this is something that will probably last longer than the 2 weeks that was initially thought about. So we're continuing to look at long-term strategies and how we do things. With that being said, I'd like to see if there's anybody that would has anything that they'd like to talk about first, and then we'll keep going. So one of the things we do talk about is, yes, in fact, we do have businesses that have closed. You have some that were just newly updated by the governor, which was bowling alleys have been closed. You have some of the, as we talked about before, some of the bars have closed. Restaurants can only give out, they can only do takeout or curbside or delivery. And for those, if you can, it would be great if you could definitely at your favorite restaurant, do a takeout order. The businesses would greatly appreciate it, as they've had a big hit to their revenues and how they conduct business. And as a community, if we all can, look and do things and work together, I think it's better for the community, and especially for our small businesses that right now are struggling, especially in those areas where the government has requested them to not operate at 100% use. Also, some of the things that we have updated as a town as well is looking at the fact of, I've asked our Park and Recs events coordinator, I've asked Laura Murphy to see if there are some opportunities to create some programs that will not cost the public anything, keep within the 6-foot distance, but help our kids with some things to do. Because I know them being out of school, there's some things, some of them are a little bit restless, and the more we can do to help everybody, the better. Right now I have somebody is very confused, Terry, as to who has the quarantine in when somebody has the coronavirus. Aside of employees that this person may work with, do employees' families have to quarantine and also? So according to Mike Crespin, who's our Department of Health director, basically you look to self-quarantine if you feel that you have some of the symptoms, if the symptomatic, if you've had direct contact with that said person, if it's more than the said person. So if it's someone that knows somebody that has that, they have the choice to self quarantine, but it's not kind of a mandated thing. Also from Hillary, how will it be handled if New Milford Hospital is filled to capacity? Is there a plan? Hi, Hillary. Yes, actually, there is a plan. I spoke to Dr. K, and basically the plan is the majority of the coronavirus people that will be infected will be going to the Danbury Hospital. That's going to be the main center for the triage. And right now they're working to provide adequate staff both at New Milford Hospital and at Danbury Hospital. But Danbury Hospital is going to be where the majority of the coronavirus triage will happen. Next is how are the elderly that don't use social media or email getting informed? So that's a great question, Captain Phoenix. So some of the things that we're doing was I started last week with using the Everbridge system, which we have about 20,000 residents that sign up for it. It's reverse 911. So we're also talking about that to residents in that way. We're also going to be using newspaper with press releases as well, and in any way possible, social as well as this YouTube and Facebook, any media that we can get out of it to address our citizenry, the better. So we're working on all those avenues to address our citizenry with updates and with news. Let's see. Should New Milford Hospital need hotel rooms for out-of-town assistance, please have them reach out to me. I'm at the Residence Inn here in Danbury. So, Jennifer, we really appreciate that. And we appreciate all the businesses that have been in the community that have given their time, given their wares and whatnot to help the community. That's what's so special about our wonderful town, is everybody pulling together and everybody doing what they can to help out people in need. I've visited several of our restaurants, and just seeing the other people coming in and ordering, that's been a wonderful thing for our small businesses and people offering. One of the things is the new thing that was coming out was some of our citizenry giving cards and materials to our seniors or people that are inbound in our care facilities, Village Crest and Candlewood Nursing Home. So it's a wonderful endeavor, and I can't thank the community enough for doing that for our citizenry that are in nursing homes. So it's just one part of how our community pulls together. Another one is, let's see here, what else do we have? We will be doing more somebody asked if we're going to be doing more 9/11 reverse calls, and yes, we will. As I said in my first one of these updates, we're going to start with once a week, but as it becomes more fluid, I'll be doing more of those, as well as more of these as well. The more that we can get out to our citizenry and reach our citizenry is the better, because it's you, the public, that we serve, and it's all about making sure that our wonderful community stays informed. Let's see if I have any others. Here's from Andrea, please have high school graduation, outside high school. So that's actually, thank you, Andrea. That's actually going to be a call made by the Board of Education and the superintendent, Dr. Parker. I know that they're working on a number of things, one of them being like to talk about and thank as well is thank our staff down at the Department of Public Works as they continue to make sure our roads are safe for our travel, making sure that we're still doing brush and side pushbacks to make sure that we have clean sight lines. And I'd like to thank them for the yeoman's work they do each and every day. Even though we didn't have a particularly snowy winter, they've been doing a phenomenal job in what they do in each and every day. And I can't thank them enough as well. Also, thank all of our staff. As I said before, not trying to be too redundant, but for each and every day coming in and creating and pushing forward the town's business, as we'll continue to do for as long as we possibly can. Next is when did reverse 9/11 go out? We did not get one. So Terry, what happens is you have to sign up for reverse 9/11, and you can do that. You can go to the New Milford Police Department website, and they have a spot there where you can click on and put in your information. Also, on a social media post, when we're completed with this, push that out, the link, so that you can do that. And then what happens is once you're put in the system, you have to reply to get in. Then you'll be receiving those calls as well. And like I said, the more different avenues that we're trying to do to get this information out to you, the public, the better that we're going to do. One of the things that I thought was very uplifting as well was before we had the initial closure of most of our businesses, I had the opportunity to speak to our aging commission, who is, they partly help us run the senior center as well as with Carolyn Haglin, our senior center director, who does a great job. And afterwards, in talking to some of the seniors, and one especially when I was outside, was telling me that they faced, as a country, we faced a lot of uncertainty. And we faced a lot of issues, from world wars, from polio, from measles, from Vietnam War to the Iran and Iraq wars. We've always, as a community, come together, and we've always been able to move forward. And I think that's exactly what we're going to do with the coronavirus pandemic we have. It's going to be difficult, and we're going to have our trials and our tribulations. But as a community working together and pulling together, there's nothing we can't do. And so that just the community that we see at large doing what they're doing now is a perfect example of that. So Linda had asked before, how do we sign up for Reverse 911? Again, is the I'll send out a link, which you can go to the New Milford Police Department website. They have a spot where you can actually voice in. It's called the Everbright system. You can put your information in. I will send that link to when we're done with this, and then you can sign up because you have to opt into something like that. And then Hillary asks, so besides staying home, are there any ways regular citizens can be helpful? Absolutely. So one of the main things we can do is check on our neighbors, especially our seniors, to make sure they're okay. Do they need anything? Can we help them get anything? Because as we've been told by the real professionals and the academics, that the coronavirus really tends to hit hard on our seniors populations and on people that have underlying conditions. So it would be very important if you know someone that is either elderly or has some underlying conditions, pre-existing conditions such as diabetes, heart disease. Please check on them, and if they need anything, if you could help them, that would be wonderful. As a community, if we do things like that, it's beneficial to everyone. The next is Deborah. Talk about what we're going to be doing and how we're doing it. I think the more that we can reassure the public, because we do have a plan in place. One of the long-term strategies that we're looking at now, and it's something that hopefully we don't have to do, but we're looking at it, is looking in case if there's any kind of food disruption, what we can do, how we can do that. So we're putting plans in place for that, and that involves our task force, and I'll be talking more about that next week as well. But it's all about planning, making sure we have a strategy in place, which we do. As I said, I'm very proud of the fact that our task force has met for well over a month. We've come up with a lot of strategies, and we'll continue to do so. And it says, rumor has it that Walmart is closing tonight at 8:30. Is that true? I'm not aware of their closing at 8:30, but what I would recommend is looking on their website or their Twitter page and seeing, because they're going to be the ones as a private institution, private company, they will be the ones making that decision, and I'm sure that's how they will relay it pretty quickly, would be that. Let's see, Linda, I appreciate that, Linda, thank you. So that she actually put the actual link on to get reverse 911, so I appreciate that. And then thank you, Katie. Where can New Milford residents go to be tested if they have symptoms? What happens is the protocol as it is in place now is if you feel that you have symptoms, you were to call your general practitioner, and your general practitioner, after speaking with you or seeing you, will then create an order. And that order is what's going to be needed to go get tested down at Danbury Hospital. That's where they're going to be requesting you to go. If in fact you feel that you have a full-blown system of coronavirus, which is difficulty breathing, coughing, high fever, and you do call 911, our dispatch team, our dispatchers are there, and they're going to ask you specific questions. If you fall into the category of the questions they ask, they then will tone, which is how they signal our first responders in a different way. And our first responders then will come with a face shield, mask, gloves, and with the gowns. And then they will be treating you a different way. And more than likely, you would be going to Danbury Hospital to get triaged first. And again, thank you, Linda. I really appreciate that. Next, as we continue to talk, is one of the things that we're looking to do too as the schools have closed. I put up on our social sites, Dr. Parker had written to all the parents kind of the expectations of the schools moving forward. Also, we did we're very nice to do a video with Diane Swanson, who is with the Pratt Center and also the Pratt School, and to talk about for kids to get outside, and also us as parents and as citizens to get outside a little bit, just to walk, to get a little bit of exercise, to get some vitamin D from the sun. So if you get an opportunity at all, please go outside, partake of some of our parks, some of our trails, walk, safely on the side of the road, and just try and get a little bit of exercise. It takes some stress off of you as well. And it also, if you do have some kids, gets them to burn off some energy. Michelle, is there any way to stop teenagers that are hanging out in big clusters and not taking this seriously? So thank you, Michelle. Actually, one of the things that we've talked to the chief about is if we do see that, we're going to ask them to disperse. As per the recommendation of President Trump, we're trying to keep people from congregating no more than 10 people together. So we're going to kind of try and comply with that as best as we can. And also it's self-awareness. Obviously, we can't be everywhere all the time. So those that are listening, or if you can relay that, just for everyone's safety, if it's not for your own safety, if it's the safety of a senior, or someone that's immune deficient. The more that we can do these things in a safe way, the better it's going to be for our citizenry. But please ask them to disperse. I know our first responders and police will do that as well. Also, we have here is Kelly, Danbury Hospital has launched their mobile test site. You must have a prescription and an appointment to be tested. Absolutely correct, Kelly. As I said before, you want to make sure that you contact your doctor, your primary physician, and they can help you if you do feel that you have those symptoms coming on. Our store will be open, this from Kay, our store will be open from 7 a.m. to 8:30 until further notice. Our auto care center will be temporarily closed starting March 19th. And then also, let's see, one of the good things, I'd like to thank Big Y. I'd like to thank ShopRite and Stop and Shop for their efforts to help our seniors with them being allowed to come in early in the morning to do their shopping. That gives them a time to do that, which I thought was very, very great. I'd like to thank both companies for doing that for our seniors and for seniors in different other communities that those stores are in as well. I think the more we can help our senior population to have access to their basic needs, but also making it in a little better and more secure situation, I think that is great. So I really want to thank both of those companies for doing that. And I think we're going to see more as we move forward. And then Lauren said, what about local hair salons and beauty shops? Are they forced to close? So as of this particular moment, and that could change at any point in time because I know the governor on the call was talking about it. Right now it's recommended closures, but I know there is a thought process right now to get those to be closed. I haven't checked anything in the last little while as I've been doing some other things and on conference calls, so I'm not sure yet as we speak at this particular moment. But as of right now, what I've heard is it's recommended. But if there is a closure, we'll definitely be putting that on our social sites and letting people know. And again, it's up to us as a community to really follow the procedures that have been set forth by the state and by the federal government and to do the social distancing, because that's what's really going to be really the key denominator, making sure that our medical facilities do not get overwhelmed, because that's what this is all about. So we just want to make sure we don't overwhelm them and then the system breaks. So the key is to social distance, do what you can. If you don't need to go out, don't go out. If you can, use our small businesses, or especially our small restaurants. You can order. A lot of them are doing takeout. A lot of them will deliver or do curbside service. So the more that we can help our local economy through these very, very difficult times, the better. Let's see. Do we have anything else here? Let's see. Samantha, I heard the government is officially closing them all. So Samantha, I'll definitely double check. If it is, I'll make note of it and on our social sites. And we'll try and keep updated as everything moves pretty fast right now on a minute by minute, sometimes basis. And we'll let our citizenry know. So if you could like my Facebook page, that's where I'm putting out most of the information first. And we'll continue to do these YouTube and Facebook live feeds as we're doing, and any questions that you have as well. And as I said, we're going to try and do these once a week minimum, and do these if we have to more, all to keep you abreast of what's going on as far as we know, and helping you prepare for the pandemic that we're currently going through. Chris, food bank is in need of feminine and personal hygiene products, paper products, including diapers, along with normal staple foods. So Councilman Cosgrove, thank you very much for that. There is a big need. Again, I'll repeat that. There need or any opportunity to help our food bank, that would be greatly appreciated. As more and more people are getting laid off and job loss, the more this food bank is going to be an integral part of their daily lives. So the more that we can help our citizenry, the better. Also, with that as well, I can't thank our culinary school that is going to be helping us out for this. Also, Loaves and Fishes, that's helping those less fortunate as well. And it's everybody pulling their resources together and working together that's going to pull us through these hard times. And I know as a community, it will be a tough road, but working together and doing the right things together, we'll definitely get through this. It'll be a difficult time, but we'll get through it. That's definitely for sure. Is our economic development person reaching out to our small businesses? So Pat, yes, we're reaching out to our small businesses. One of the things that the governor did do is he declared this an economic emergency. So that allows for some funding to come in. We've put on our sites where you as a small business can fill out the forms. I believe it's about 4 pages. And if you could bring it and send it to mayor@newmilford.org, we can make sure and put that in the packets as we're sending to the state. Also, in the conference call that I was on today with the governor and with the commissioner of economic development, they're working hastily to come up with some new programming. They'll be rolling out some as early as next week to help our small businesses and to those that are unemployed. I'll have more on that some later on today and more as it's getting rolled out to us. And the emphasis is to make sure that our citizenry can stay in their homes, stay in their rentals, have access to funding for daily needs. And I'll be following up with more as I hear as well. And then you have Melissa asking, any talk about shutting down daycare centers? So currently there's been a lot of talk, especially from the state as far as daycare centers. The major concern is that if daycare centers are closed, those first responders, being our nurses, our firemen, our policemen and women, would have to stay home. And if they stay home with a system that would be overwhelmed, it would multiply that effect. So right now they're continuing to assess it. I know the State Department of Public Health, our Department of Public Health here in New Milford, and the state government is really monitoring that situation. And that's on a day-by-day, hour-by-hour basis. Just seeing if we have any more questions here. And lastly, again, I cannot thank you, the public,